it has some conducting system. The electrical impulse normally starts from SA node, then pass to AB node through internodal pathway, then goes to bundle of hits. Then it is divided into two parts, right bundle branch and left bundle branch. Then go to Purkinje fiber. When defect occurs in this pathway due to sclerosis or calcification, defect in this pathway, heart block may occur. What is heart block? Heart block, extreme slowing of the heart rate due to defect in conducting tissue in heart leading to low cardiac output, less blood supply to brain. Lack of oxygen in brain causes blackout, giddiness, loss of consciousness, convulsion according to the duration of anoxia. Some factors related to this heart block is mostly elderly patients are affected, also younger patients are affected, children also, but rare case also affected. Sex, male are more affected than female. What is causes of heart block? Congenital heart block. Congenital heart block occurs those babies whose mothers have autoimmune diseases such as SLE, lupus. Acquired heart blocks due to sclerosis and calcification, it is seen. Many factors example includes damage to the heart after myocardial infarction, coronary heart disease, dilated cardiomyopathy, ischemic heart disease. Next, types of heart block. Mainly, heart block is divided into three types: first degree heart block, second degree heart block, and third degree heart block. Fascicular blocks also seen in two types, bifascicular and trifascicular. First degree heart block. First degree heart block is characterized by delay in conducting system from artery to ventricle. Delay. Next, second degree AV block. Second degree AV block characterized by dropping. This is also divided into two categories. In Mobius type 1 and Mobius type 2. In Mobius type 1, there is a gradually increases of PR interval and followed by QRS complex. And in Mobius type 2, there is some POF are not conducted to the AV node, that is 2:1 or 3:1 block are seen in this type. In Mobius type 1, also called Wenckebach phenomenon. In third degree AV block, artery contacts its own rhythm and ventricle also contacts its own rhythm. There is no association between artery and ventricle. Fascicular block. Bifascicular block is a combination of right bundle branch block with left anterior hemiblock or posterior hemiblock. Trifascicular block, left anterior hemiblock, right bundle branch block and with prolonged PR interval. Due to lack of oxygen in brain, some symptoms are patient complex, some symptoms giddiness, shortness of breath, blackout, convulsion, etc. When patients comes in our hospital, some investigation are to be done According to the doctor's advice, ECG, Holter monitoring 24 hours, echocardiography, chest X-ray, blood test routine and cath profile also. This is normal ECG. POF, PQRST, this is on cycle. POF represents arterial contraction, arterial depolarization. QRS complex represents ventricular depolarization. TOF represents ventricular depolarization. From this ECG we also calculate heart rate. 1500 heart rate equal to 1500 divided by number of small square. Now I am showing first degree heart block. Here PR interval. Here PR interval is gradually increases. PR interval gradually increases. That is first degree heart block. Next, second degree heart block. PR interval gradually increases and followed by QRS complex. This is Mobius type 1. Next, this is Mobius type 2. ECG of Mobius type 2. 2 POF, then followed by QRS complex. Some POF are not followed by QRS complex. This is Mobius type 2. And last, third degree heart block. For third degree AV block. Here POF, arteria contracts its own rhythm and ventricle also contracts its own rhythm. There is no relation between arteria and contraction, arteria and ventricle. Here ventricular rate is slow. Approx 40 per minute, 40 beats per minute. Arteria also slow. There is no POF and QRS complex. PP interval is regular. RR interval also regular. Now treatment. Treatment of heart block. If patient comes with patient symptomatic, to stop beta blocker like metolar, atenolol, those drugs reducing heart rate, those must be stopped, and start tablet oxyprenolin or alloprent and injection isoprenoid IV also slowly with NS to be given according to doctor's advice. In first degree heart block and bivesicular block without syncope, no need for surgical intervention, only medical management to be given, and other drugs, other blocks, second degree or third degree AV block or bivesicular, trivesicular with syncope, only treatment is pacemaker implantation. Pacemaker implantation, clinical deterioration of heart block when patient occurs clinical deterioration of heart block due to second degree heart block or complete AV block, temporary pacemaker as to be inserted as soon as possible by doctor. We also use non-invasive or invasive pacemaker. Non-invasive pacemaker we are used externally, and invasive pacemaker we are used through venous route. Then permanent pacemaker. Permanent pacemaker here also used in our practice, single chamber and dual chamber. single chamber pacemaker, single chamber lead only test and sensing ventricle, and dual chamber lead artery and ventricle, both are paced and sensing. What is pacemaker? Pacemaker is a small implantable medical device that generates electrical impulse to stimulate the cardiac muscle. Pacemaker has two parts: pulse generator containing battery and circuitry, and second, electrode. This is pacemaker, and this is connected with lead. One lead is kept in atrium and another is kept in ventricle. Ventricle RVFX, it is kept. Atrium is sensing by this lead and ventricle also sensing ventricular lead. This is dual chamber pacemaker. Some nursing measures to be taken after and before doing pacemaker implantation, that is preoperative and postoperative care. My in charge will tell about this. Thank you.
Thank you, Shika. Good afternoon, everybody. Now I am going to discuss in details about main nursing role of a pacemaker patient. আমরা সকলে জানি পেসমেকার জিনিসটা কি, কিন্তু এই জানার মাঝেও কিছু ফাঁক থেকে যায়, মানে আমরা পুরোপুরি জানি না, যার জন্য আমাদের নানা রকম প্রশ্নের সম্মুখীন হতে হয়। যেমন পেসমেকার আছে, আমরা এটা করতে পারবো তো? আসুন আজকে আমরা এই নিয়ে একটু আলোচনা করব। Preoperative nursing management, warm reception with comfortable bed. Explain the procedure to the patient, his and her relatives, and give assurance. Consent to be taken, routine blood investigation including cath lab to be done. Injection tetanus toxoid to be given, antiseptic dressing to be done, local part. এখানে একটু উল্লেখ করি, লোকাল পার্ট বলতে কতটা ইমপ্লান্ট হবে তো ছোট্ট একটা জায়গা, তাহলে কি সেটুকু জায়গায় আমরা অ্যান্টিসেপ্টিক ড্রেসিং করবো? তা না, আমাদের করতে হবে অ্যাক্সিলা টু মিড থাই ইনক্লুডিং প্রাইভেট পার্ট। তারও একটা রিজন আছে, কারণ আমরা রুটিন ওয়াইজ কোনো পেশেন্টকে পার্মানেন্ট পেসমেকার করার আগে রুটিন মাফিক আমরা টেম্পোরারি পেসমেকার করি থ্রু ফিমোরাল ভেন, সেই জন্য আমরা অতটাই করতে বলি। অ্যাপারেটাস অ্যাসোসিয়েটেড, emergency trolley, wall separators, NIV with pad, temporary pacemaker, pacing catheter and introducer. Observation. Observe vital sign and symptom of the patient, any local infection like skin erosion or skin disease, etc. Any thrombophlebitis. Postoperative nursing management. Patient to be kept in supine position for 24 hours to avoid lead displacement. Monitor vital signs and symptoms. Observe any soakage or any swelling of the operated area. Encourage leg movement to prevent bleeding. Operated hand movement to be restricted. Normal diet to be allowed. Prescribed antibiotics and anti-inflammatory drug to be given in time. Prevention, not to use soap or any ointment on the operated side, at least to wear clean cotton clothes to prevent infection and irritation. Advice on discharge. Advice on discharge. Carry always pacemaker identity card, if possible, to wear medical alert আর্মলেস ব্রেসলেট নেকলেস। এটা আমাদের এখানে এখনো চালু হয়নি, ফরেন কান্ট্রিতে এটা ইউজ হয়। প্রোডাক্ট অ্যাভয়েড দ্যাট ইউজ অফ ম্যাগনেটিক থেরাপি লাইক MRI। Next, another important role to convey the patient, follow-up every 6 months or any alarming symptoms like fever, infection, palpitation, chest pain, respiratory distress, fainting attack or syncope. Encourage the patient consult with doctor before going any medical or surgical procedure. This is another important part. Pacemaker care to be given throughout life till death for prevent secondary infection. Now I am telling what patient can do or do not. What patient can do: limit use of arm up to 1 to 3 months. Drive car after 4 weeks. Light household work like cooking, dusting, washing, etc. Electrical items are used. এখানে বলতে গিয়ে একটু বলতেই হয়, বাস্তবিক ক্ষেত্রে আমি আউটডোরে থাকি, আমি বারবারই এই প্রশ্নের সম্মুখীন হই, সিস্টার এটা করতে পারবো তো, এই ইলেকট্রিক জিনিস ধরতে পারবো তো। শুধু পেশেন্ট নয় বা নন মেডিকেল পার্সন নয়, মেডিকেল পার্সন যারা এই কার্ডিওলজি ডিপার্টমেন্টের সাথে নয়, অন্য কোনো ডিপার্টমেন্টে আছে, তারাও অনেক সময় প্রশ্ন করেছে যে মাইক্রোওয়েভটা ইউজ করা যাবে কিংবা আয়রন করা যায় কি। তাহলে আসুন আজকে আমরা কী কী জিনিস ইউজ করতে পারবে পেশেন্ট, সেটা আমরা একটু বিস্তারিতভাবে জেনে নিই। ইউজ করতে পারবে রেফ্রিজারেটর,